This is a paid advertisement.
Welcome back to the Noon Show on WBAY TV2, and welcome to Ask the Expert. We're joined today by Dr. Jacob Walt of Tower Clock Eye Center. Thanks for being here today, Doctor.
Absolutely. Thanks for having me.
Routine eye exams are important for everybody, but someone who's been diagnosed with diabetes, it becomes especially critical, right?
That's absolutely right. For patients who've been diagnosed with diabetes, it is recommended that they have a dilated eye exam every year.
When you say dilated, what exactly does that mean? What does the eye exam entail for the individual?
Good question. So dilation means that we place special eye drops in the eyes that open up your pupils so that we can get a good look at the entire health of the retina, which is important for patients who have diabetes.
What specifically are you looking for when you do that eye exam? I would imagine there are some red flags for you.
There are. So what we're looking for is any areas that may indicate that the blood vessels are compromised, areas where we see small pinpoint bleeding, leaking of fluid out of blood vessels, things of that nature that may indicate that blood sugar is not under as good of control as we would like.
What is the routine like for the individual? I remember always having a driver that had to make sure they got you to and from, and what is it like nowadays?
Absolutely. So I would always recommend that if a patient is uncomfortable driving after an eye exam, that they bring a driver with them or be able to arrange a ride after their appointment. Dilation itself is not a contraindication for driving, meaning patients can still drive after their appointment, but we would typically recommend that they have a plan if they're uncomfortable.
What is the best way for folks to get started with you?
The best way to get started is to call our office or to visit our website to set up an appointment.
And that information is right there on your screen, always available by going to WBAY.com and clicking on Ask the Expert. We'll get you back to the Noon Show right after this.
The preceding was a paid advertisement.